A lot of our patients come in and they're just besides themselves, and they come in with their spouse, and they've been to a lot of different places. They've tried everything is what they usually say. A lot of people want to exhaust everything naturally first. That's where a lot of people start to do some research, and they might find non-surgical spinal decompression.
I couldn't lift anything, I couldn't do yard work. I literally couldn't sleep through the night. I would wake up and have to walk around for an hour just to get the pain to start to subside enough that I could sleep a little bit. And it really got to a breaking point when I was on a road trip, and I had to stop about every hour to get out and walk around because the burning in my leg and the pain was just so bad that I couldn't even take it. At first, I didn't get a lot of answers when I went to my regular doctor, but then I came here to see Dr. Hoover, and from the moment we met, he started analyzing what was going on with my back, and that's when he suspected that there was some herniation happening, and so we started some treatment. There was a little discomfort when I first started the decompression therapy, but that was very minimal. I mean, because the relief set in. I was shocked that after the first 2 treatments, how much better I was feeling already. It was crazy to me. Within a month of treatments, I was moving around again and doing things, and now it's been a year, and I was out hiking in Yosemite with a full backpack, and that's something I would have never done a year ago.
What is non-surgical spinal decompression?
It helps the spine to heal with the active tissue that's already in your spine. So a lot of people might not know that once you've had an injury, like a disc herniation, or if you just have degeneration that a lot of people get throughout their lives, that the spine can still heal itself. And the way that it does that is with healthy tissue that is still in the disc, but it doesn't necessarily have a good blood flow. So what this is able to do is to create a negative pressure that draws blood flow, and that blood flow brings in oxygen deep into the disc, and that helps the active tissue to repair and regenerate the spine that's been damaged.
What type of injuries do you treat?
We treat disc bulges, stenosis, and sometimes that stenosis is secondary to a disc bulge or something called degeneration. Some of those conditions could cause the symptoms of sciatica, which is just a word that means that you have pain in your leg. But when someone comes in and they say, "Dr. Hoover, I have sciatica," what is that? It's just a symptom of one of the other diagnoses. I'm still looking for a diagnosis at that point.
And tell me about Tom. Is he typical?
Honestly, I gave Tom about a 10% chance of healing up. His disc herniation was so severe, it's what's classified as an extrusion. So the disc material hasn't just bulged, it hasn't just protruded, it has extruded fully outside of the disc. So in that scenario, that is very touch and go. Maybe 10% of people would get better from that. His case specifically, we were still optimistic because he wasn't doing anything that was aggravating his condition. The before and after images were 1 month and 3 days apart, to where in July he had this gigantic disc extrusion, and a month and 3 days later it had healed from the decompression that we had done.
No surgery, no drugs, no medication. I just came in for regular adjustments and then the decompression therapy. Between those two, it was life-changing for me.